The supply closet at St. Michael's smelled like bleach and old bandages. Margaret Walsh stood alone among the shelves of saline bags and surgical tape, her locker door open, her trembling fingers, just barely trembling, pressing against the fabric inside her jacket lining. The patch was faded now, barely visible in the fluorescent light that bled under the door. 75th Ranger Regiment. The colors had faded from forest green to something closer to ash, but her hands knew it the way a prayer knew its words. She closed her eyes. Let herself breathe. 1 exhale. 2. The trembling stopped. Her hands went still. When she emerged 30 seconds later, her badge was clipped straight, her expression neutral, her scrubs pristine. Nobody saw. Nobody ever saw. The emergency department hummed with its usual rhythm, monitors beeping in their mechanical chorus, shoes squeaking on tile floors, the distant rattle of a crash cart being restocked. Margaret moved through the corridors of St. Michael's with the kind of efficiency that came from doing something for 3 years straight, 8 hours at a time, for days a week. She knew where the trauma bays were before the ambulance bay doors opened. She knew which residents would freeze under pressure and which ones would fight to keep a patient alive. She knew Dr. Pierce's schedule better than she knew her own. But she didn't think about any of that as she approached bed 7. The Army Ranger lay motionless, his left arm draped across his stomach. His name was Marcus Chen. 26 years old. No family listed in the emergency contact field, which meant someone, probably a military buddy, had filled it out for him. His eyes were open but aimed at nothing. That was the traumatic brain injury talking. That was the result of being thrown sideways through the driver's side window of a rolling semi-truck when a drunk driver had clipped the right side of I-16 6 months ago, back when Margaret had still believed in her cover. 6 months. It felt like 6 years. She remembered every detail of that day. The late afternoon sun hammering down at 98 degrees. The smell of burning rubber and diesel fuel mixing in a way that made her stomach clench. The semi-driver screaming that he couldn't get the radio to work, that he couldn't reach anyone, that nobody was coming. Margaret had been driving home from her shift when she saw the smoke. She'd seen the overturned cab. She'd pulled over without thinking, muscle memory taking over the way it always did when something went wrong. The paramedics were 7 minutes out. The bleeding was catastrophic. Marcus's left side was crushed. Pneumothorax, a collapsed lung filling with air that pressed against his heart, slowly suffocating him from the inside. His oxygen saturation was dropping. 68%. 64%. The sound he was making wasn't quite crying. It was the sound of a body failing, gasping, drowning in air. Margaret had felt for the second intercostal space, midclavicular line, the way her hands had learned to do in a medical evacuation helicopter over Helmand Province. She'd used a ballpoint pen, the plastic kind that came from the truck's glove compartment, inserted it at a 45-degree angle, and the hiss of air escaping had been louder than the sirens. His oxygen saturation climbed. 82%. 88%. 91%. Stable. When the ambulance arrived, the paramedics had looked at the pen protruding from his chest like she was insane. She'd said only, decompression needle. He was crashing. You have about 6 minutes before the air pocket redistributes. They'd called her a nurse and she'd accepted the title like it was her real job, not her cover, not the thing that let her keep watching the patient who was now failing in front of her for reasons that went much deeper than a traffic accident. The patient in bed 7 had her name tattooed on his forearm. M. Walsh, my angel. 2 inches long, in military script, the letters dark and precise. She'd seen it in the ambulance bay, seen it on his first night in the ICU, seen it every single shift for 6 months. He'd had it done sometime after she'd pulled him from that wreckage, sometime after the needle decompression had given his lungs room to expand, sometime when he was lucid enough to find an artist and sit still long enough to have her initials carved into his skin. The nurses had talked about it. There was a strange tenderness in how they mentioned it, a recognition that somewhere in his broken mind, Marcus Chen remembered an angel at the side of a burning highway. He didn't remember her face. That was the injury. That was the damage the steering wheel and the airbag and the force of the crash had done to the part of his brain that held faces, names, the geography of gratitude. He looked at her every shift with polite emptiness. A stranger. A nurse checking his vitals. Someone whose hands moved efficiently over his chart while his eyes tracked nothing. Margaret stood at the foot of his bed now. She checked his bandages. Monitored the drainage from his chest tube, minimal, good. Reviewed his last set of vitals. Oxygen saturation 95%. Heart rate 84. Blood pressure holding steady. Everything was exactly where it should be. Everything was exactly where it would be if a field thoracotomy hadn't been performed by hands that were supposed to be civilian hands, hands that were supposed to belong to someone named Margaret Walsh, RN, who had never heard of the 75th Ranger Regiment or Helmand Province or the woman she used to be. She was reaching to adjust his fall line when her fingers brushed the tattoo. Just barely. A touch so light it wasn't really a touch at all. Her initials. Her name. Her call sign, if anyone had cared to look deep enough. M. Walsh, my angel. The ink was holding up well. The edges were crisp. The man who had gotten it done had somehow found an artist good enough to make the letters look like they meant something, like they carried weight. Marcus Chen didn't move. Didn't flinch. Didn't recognize her. She continued to the supply closet. This time when she closed the door, she locked it. She pressed both palms flat against the cool metal shelves. Her breathing was even. Controlled. Everything by the book. But her jaw tightened, just barely tightening, and her hands pressed harder against the metal than they needed to. She unbuttoned the top of her scrubs, slipped her finger down to the jacket lining, and touched the patch. 75th Ranger Regiment. 3 tours. A woman named Captain Margaret Walsh who had performed emergency thoracotomy under direct enemy fire. A woman who had done field surgery with a combat knife because there was no time for proper instruments and the alternative was watching people die. A woman who had breathed that air and seen that light and carried those memories in the same hands that were now spent on checking for sights and monitoring drain output. The supply closet was soundproof enough that nobody could hear her breathing wasn't quite steady anymore. She buttoned her jacket. Unlocked the door. Stepped back into the fluorescent world of St. Michael's emergency department. The fluorescent lights buzzed overhead with the sound of angry wasps. Somewhere down the corridor, a monitor was alarming. A resident was taking direction from a more senior physician. The hospital moved the way it always moved, with its own internal logic, its own chain of command, its own rules about who got to do what and who had to stand aside and let others fail. Dr. Pierce was waiting. He stood in the trauma assessment area, watching her approach with the kind of expression that suggested he'd been watching for a while. His posture was upright, military straight almost, though she knew for a fact that he had never served. His face carried the kind of tan that came from golf courses in Savannah, not from desert sun. His hands were manicured. Soft. The kind of hands that had never had to do anything they didn't want to do, never had to make a choice between following protocol and keeping someone alive. He was holding a patient chart. One of his residents stood nearby, trying not to look nervous. Margaret approached without making eye contact. Standard protocol. Deferential. The way a person looked when they understood their place. Nurse Walsh. His voice was like a tank idling in a garage, low, contained, suggesting there was much more power available if he chose to deploy it. I observed your assessment of the trauma case just now. Quite efficient. Almost competent, if it weren't for the fact that you appear to be making clinical decisions above your station. She didn't respond. Didn't flinch. Didn't change her breathing. Tell me. He gestured toward the resident beside him. Do you believe a nurse is qualified to establish clinical priorities in a trauma assessment? The resident looked at his shoes. No, sir. Of course not. A nurse is qualified to take orders, document findings, and implement the clinical decisions made by physicians. He turned back to Margaret. You performed a competent initial assessment. That is your job. What you did not do was make decisions. What you did not do was communicate your priorities as though they held the same weight as medical judgment. Are we clear? Margaret's jaw tightened. Just barely. The way it always did when he spoke. The way it had tightened for 3 years now, accumulated insult by insult, the small cuts that were meant to bleed slowly and invisibly. She said nothing. Because nothing was the correct response. Because speaking would mean acknowledging that he could affect her. Because the only power she had left was the power to not let him see that he mattered. I asked if we're clear, Nurse Walsh. Yes, Doctor. 8 words. Quiet. Efficient. The voice of someone who had learned to disappear. He smiled. The smile was what made the resident finally look away, because the smile suggested that he had gotten something he wanted, something about forcing her to confirm that she understood her place. He turned and walked away, still holding the chart, still trailing his certainty like cologne. The resident followed him, leaving Margaret alone in the trauma bay. But that wasn't quite accurate. Margaret wasn't alone. She could feel the weight of the patch inside her jacket lining. She could feel the muscle memory in her hands from 6 months ago, from the moment when a needle decompression with a ballpoint pen had been the only thing standing between a man and death. She could feel the difference between the person she was pretending to be and the person she actually was, the gap between those two identities growing wider every single shift, a fault line that was going to rupture one of these days, and when it did, nothing was going to be the same. She looked back toward bed 7. Marcus Chen was still staring at nothing. His arm was still draped across his stomach. His tattoo was still there, visible beneath the hospital gown. 2 inches long. Military script. M. Walsh, my angel. He had no idea she was there. He had no idea she was anything other than another nurse in a building full of nurses. He had no idea that the woman who had saved his life on a burning highway 6 months ago was standing 20 feet away, watching him breathe, listening to his monitor alarm, waiting for the moment when everything was going to go wrong. Because it was going to go wrong. That much she could feel, the way soldiers felt incoming artillery before they heard it. Something was coming. Something that was going to force her to choose between staying hidden and staying alive. Something that was going to make staying quiet impossible. She didn't know yet what it was going to be. But she could feel it waiting. The Grand Rounds conference room at St. Michael's smelled like coffee and institutional fear. 12 residents and 4 attending physicians sat in tiered rows, their clipboards creating a soft percussion of paper and anxiety. Dr. Pierce stood at the front, Margaret's patient chart held aloft like evidence at a trial, his tailored suit catching the overhead lights with the kind of precision that suggested he'd dressed for an audience. Nurse Walsh has diagnosed septic shock based on, what was it, Margaret, 20 years of emptying bedpans. His voice carried the particular cruelty of a man who understood the geometry of humiliation. The room didn't laugh yet. They were waiting for permission. Margaret stood at the back of the conference room, chart in hand, her posture unchanged. Her jaw tightened almost imperceptibly, a muscle contraction visible only if you knew to look. Her hands remained steady on the medication tray she'd brought to present the case. Pierce continued, his eyes never leaving the residents. The patient's lactate was 3.2. Nurse Walsh interpreted this as metabolic acidosis secondary to sepsis. A reasonable conclusion, perhaps, if one spent their time mopping floors rather than reading pathophysiology journals. He paused, letting the silence crystallize. In reality, the elevation is mild, almost certainly related to mild dehydration. The CT scan shows no source of infection. The blood cultures, which won't result for another 36 hours, will come back negative. One resident shifted slightly. A younger attending physician scribbled something on his notepad, the kind of urgent notation that suggested he was already composing the story he'd tell the cafeteria later. Margaret's eyes remained fixed on the vitals monitor mounted on the wall behind Pierce. Her fingers didn't move. Her breathing didn't change. She was a woman watching someone discuss a chess move while her knight was already 3 moves ahead. The lesson, Pierce announced, turning to face the residents directly, is the danger of clinical presumption. Staff members without formal medical training often mistake pattern recognition for diagnosis. They see clusters of symptoms and leap to conclusions that feel logical but are, in fact, dangerously wrong. He set the chart down on the table with the finality of a judge's gavel. Questions. 3 residents raised their hands. Pierce called on the tallest one, a 4th year who looked like he'd been constructed specifically to validate every professional decision Pierce had ever made. Margaret turned and left the conference room, her white shoes making no sound on the linoleum. The door closed silently behind her. In the hallway, her breathing remained even. Her heartbeat didn't accelerate. She had learned long ago that physiological reactions were negotiable, that panic was simply a story the body told before the mind had finished thinking. She'd learned this in Helmand Province, during a patrol gone wrong, when staying calm meant the difference between extracting an entire squad and explaining 3 flag-folded caskets to wives whose names she would never know. By evening, Margaret's patient's white blood cell count had climbed from 14,000 to 21,000. His lactate had risen to 4.1. The fever was back, 101 point for Fahrenheit with a shaking chill. Margaret called Pierce at 7:44 p.m. to report the change in clinical status. The lactate progression and leukocytosis suggest acute infection, she said, her voice carrying the careful deference of someone speaking to power. I recommend we initiate empiric broad-spectrum antibiotics and repeat blood cultures. Pierce didn't pause. The patient is stable. We'll reassess in the morning. Your clinical anxiety isn't an indication for unnecessary intervention. He hung up. Margaret documented the conversation in the chart and continued her rounds. 2 days later, the break room at St. Michael's held the particular staleness of a space where people came to avoid work rather than enjoy food. The vending machines hummed their electric prayer. The fluorescent lights buzzed overhead with the persistence of insects. Margaret had come for coffee, nothing more, a 10-minute break between the 6 a.m. medication pass and the 7 a.m. wound checks. She was inserting her dollar bill when Dr. Pierce walked in, trailing 3 residents like a conductor with an orchestra. His voice rose immediately, the tone calibrated for maximum carry. You know what's extraordinary, he said, moving toward the refrigerator. Nurse Walsh thinks 3 years on the IR-16 corridor makes her a trauma surgeon. Someone should tell her that wiping blood off highways doesn't qualify you to interpret CT scans. He opened the refrigerator with the theatrical precision of someone performing for an audience. Hands-on experience with roadside accidents doesn't translate to clinical judgment. It's like thinking that washing cars makes you a mechanic. Laughter rippled through the break room, the kind of nervous laughter that comes from relief at not being the target. 2 residents actually laughed. One attending physician smiled into his yogurt. Margaret's hand remained on the vending machine button. She pressed it. The mechanical whirring sounded like something dying slowly. The coffee cup dropped into the dispenser with a hollow clink. She retrieved the cup, measured 1 sugar, 1 cream. No reaction. No flinch. No voice crack. Her hands were steady as surgical steel. Her face was the expression of someone reading a weather report, information without attachment, facts without feeling. She walked past Pierce without acknowledgement. The break room fell silent for exactly 3 seconds after she left. Pierce was already turning back to the residents, launching into another story about inadequate clinical training in nursing school. But in the supply closet 12 minutes later, with the door locked, Margaret's hands began to shake. Not from fear. Not from anger. From the effort of restraint, the constant, exhausting work of compression. She reached inside her scrub jacket and found the faded unit patch sewn into the lining, the fabric worn soft from years of being touched in moments like this. 75th Ranger Regiment. The colors had faded from repeated washing. The edges were frayed. It was the only piece of her real life she'd brought into this hospital, and she was using it the way other people use rosaries or photographs, as a talisman against dissolution. She held it for exactly 60 seconds. Then she tucked it back into the lining and opened the supply closet door. That evening, she made a medication adjustment in the Ranger patient's full line. The chart would later show that she'd corrected the potassium supplementation from 40 mg to 20 mg. The original order, as written by Dr. Pierce, would have caused severe hyperkalemia, cardiac dysrhythmia, potential cardiac arrest in a man whose neurological system was already fragile, already compromised, already on the precipice. She corrected it quietly. No announcement. No drama. No defensiveness. She simply walked to his room, reviewed the order, found the error, and fixed it. The kind of work that nurses do hourly, the invisible maintenance that keeps people alive. Dr. Pierce found the correction 15 minutes later when he was reviewing the patient's chart during his evening rounds. His face moved through several expressions in rapid sequence: confusion, then understanding, then something that looked like fury. He picked up the chart and walked directly to the ranger's room, where Margaret was checking the foresight. "You changed my order," he said. It wasn't a question. The potassium concentration was incorrect. Margaret's voice was respectful, deferential, the voice of someone acknowledging a superior's authority while stating a fact. 40 mg in a patient with baseline renal compromise could cause severe hyperkalemia. "I wrote the order," Pierce said. "I didn't ask you to second-guess my clinical decisions." "It was a medication error," Margaret said. She was still checking the foresight. Her hands didn't pause. The dosage would have been dangerous. Pierce pulled out his radio. "Security. I need an escort to the Ranger unit. Nurse Walsh is exhibiting insubordination and creating a hostile work environment. She's becoming a danger to patients." His voice carried across the unit with the certainty of someone accustomed to being obeyed. 2 security guards appeared within 4 minutes. They didn't actually escort her out. Pierce seemed to lose interest in the action once he'd announced it, satisfied with the performance itself. But everyone on the unit had heard the call. Every nurse, every resident, every tech who was within radio range understood that Margaret Walsh had crossed a line that couldn't be uncrossed. She finished her shift without speaking to anyone. She charted her notes with the same precision she'd brought to everything. She didn't explain. She didn't defend herself. She was a woman watching the perimeter walls of her concealment grow higher by the hour. When she walked out to the parking lot at 11:16 p.m., the October night was cool enough to feel like mercy. She sat in her car for 20 minutes without starting the engine, her hands gripping the steering wheel at exactly the 10 and 2 positions, her breathing controlled and even. Rain started to fall, soft at first, then harder, then with the persistence of judgment. What happened next didn't just change Margaret's life. It shattered every assumption about who she was and what she was capable of becoming. The monitor screamed. One long, continuous wail that turned the trauma bay into a cathedral of panic. The Ranger convulsed. His back arched off the bed in a terrible, impossible geometry, muscles locked, joints bending toward angles that shouldn't exist. His body was trying to tear itself apart from the inside, electricity firing through his nervous system in a cascade that wouldn't stop. Grand mal seizure transitioning to status epilepticus. The kind that kills if you don't break the cycle. His airway was collapsing. Dr. Pierce stood frozen at the crash cart, his manicured hands fumbling with the intubation kit. The laryngoscope clattered to the floor. He reached for it, hesitated, reached again. His jaw clenched. The Ranger's oxygen saturation dropped on the monitor, 94, 88, 76, 63, and Pierce was still holding the endotracheal tube like a man who'd never seen one before, his fingers trembling in a way that suggested 3 medical degrees and 20 years of authority had evaporated in 30 seconds. The room held its breath. Nurses frozen. Residents staring at the monitor as the Ranger's limp percentage plummeted toward the red zone where brains die. 60 seconds without oxygen. That was the clock. They were at 45. Margaret didn't think. Muscle memory overrode 3 years of careful submission, 3 years of nodding and accepting, 3 years of being the invisible woman who absorbed insult like desert sand absorbs rain. Her hands moved on their own. They always did when something was about to die. She crossed the room in 2 strides. "Step back, doctor." Not a question. a command delivered in a voice that dropped an octave, the same voice that had called fire missions in Helmand Province, that had ordered men to move when their legs didn't want to, that had spoken in the darkness of field hospitals where the only light came from flashlights and the only sound was screaming. Pierce didn't move. His face had gone white, then purple, then the color of a man watching his authority dissolve like morning mist. He opened his mouth. Closed it. His hands were still trembling. Margaret reached past him, her fingers steady as surgical lasers. The crash cart stainless steel surface was cold under her palm as she selected a 14-gauge needle, not the laryngoscope Pierce had been fumbling with, not the endotracheal tube that required 2 hands and a throat anatomy he couldn't seem to access. She needed an airway. Now. She located the cricothyroid membrane by feel, her fingers finding the cartilage landmarks like she'd done this yesterday instead of 11 years ago. The ranger's neck was wet with sweat. His convulsions had intensified, his body still locked in that terrible seizure, oxygen dropping, 57, 51, 48, and the fluorescent lights overhead hummed their mechanical indifference, completely unconcerned that a human being was dying in the next 30 seconds. Margaret selected a scalpel from the tray. Not the surgical blade. The sharp one. The kind that understood tissue the way a musician understands an instrument. She didn't hesitate. Hesitation was for people who'd never had to choose between protocol and breathing. She made the incision through the cricothyroid membrane with the kind of precision that comes from having done field thoracotomy under mortar fire, from having cut open a chest cavity in the dirt behind a compound wall while rounds snapped overhead like angry wasps. The blade was an extension of her hand. The incision was clean. Professional. Absolutely illegal in a hospital setting without a surgeon's authorization. Blood pooled, not much, the membrane was thin, and the air hissed out like a pressure valve releasing. She guided the needle through the opening, feeling the resistance of tissue give way, and then the wheeze of air flowing where air needed to flow. The monitor's wail changed pitch. 62. 68. 74. The ranger's oxygen saturation began to climb, the seizure beginning to break its grip, his body recognizing that it could breathe again, and slowly, incrementally, the terrible convulsions loosened their hold on his muscles. 81. 87. 90. Margaret's hands were steady as stone. Her breathing was controlled. Her eyes were fixed on the vital signs climbing back toward safe numbers, climbing back toward the land of the living. Only her jaw moved, tightening imperceptibly, the only tell that anything inside her had just shattered into 1,000 pieces. She turned to the resident at the monitor. Get sedation. Push 2 milligrams midazolam now. Then get him on continuous EEG monitoring. I want full neuro workup, CT, labs, the whole protocol. No one moved. Now, she said. The resident moved. Pierce was staring at her like she'd just materialized from another dimension. His face had gone beyond purple into something closer to gray, the color of a man whose entire universe had inverted itself in the space of 90 seconds. His mouth opened. Closed. Opened again. He looked down at his hands, still trembling, still holding the intubation kit he'd never gotten around to using, and then he looked back at Margaret. She didn't meet his eyes. She was already reaching for gauze to control the bleeding at the surgical site, her movements precise and efficient, her hands moving with the terrifying fluid precision of apex predators who'd learned efficiency meant survival. The ranger was breathing. The crisis was contained. The needle stayed in place while they got him properly sedated and moved to ICU for the continuous monitoring he'd need. Oxygen saturation was good now, 89 and steady, but status epilepticus that severe meant his brain was on fire and she wasn't going to let some administrator who couldn't intubate a dead practice dummy oversee his recovery. The trauma bay moved with sudden purpose. Nurses called out vitals. The respiratory therapist wheeled over the portable ventilator for backup. The charge nurse, a woman named Davis who'd seen Margaret absorb Pierce's cruelty for 3 years without flinching, looked at Margaret with something that might have been recognition, might have been the dawning realization that the quiet woman she'd been silently pitying had just revealed something that couldn't be unlearned. Margaret washed her hands at the sink. The water was hot enough to burn. She didn't flinch. She scrubbed the blood from her knuckles, the ranger's blood, the ranger whose name she couldn't quite say out loud anymore because he'd forgotten her the moment he'd woken up in this hospital, and she'd learned to live with that particular grief in silence. Dr. Pierce had left the trauma bay. His absence felt like the air pressure dropping right before a storm. Margaret dried her hands. 20 seconds. That's all it took for a medical team to go from panic to functional, for a dying man to start breathing, for a 3-year cover to evaporate like morning dew under a military sun. She pulled her phone from her pocket. Not supposed to, not during a code, but her hands didn't ask permission anymore. She had a message. One word, all caps, from a number that was supposed to be burned after her initial handler briefing. Exposed. The phone went back into her scrub pocket. Her jaw tightened again. The trembling wasn't fear. The trembling was restraint. The kind of restraint that comes from knowing exactly what happens when you stop holding back, and knowing that moment might be coming whether she was ready or not. She walked back to the ICU where the ranger was being admitted, sedated now, his breathing steady and artificial through the proper airway that had been established once Margaret had created space for it to exist. His chest rose and fell with mechanical consistency. His eyes were closed. His arm with the tattoo lay motionless on the hospital blanket, M. Walsh, my angel, and she didn't look at it because looking at it meant remembering who she used to be, and the woman who used to be that person had just exposed herself completely in front of the entire night shift. The intercom crackled to life, overhead speakers summoning Dr. Pierce to the hospital administrator's office. The code in his voice suggested urgency. The hospital administrator, according to the overhead system, was requesting his presence immediately. Margaret watched the ranger's oxygen saturation hold steady on the monitor. 91%. Safe. Sustainable. Alive. She had maybe an hour before everything changed. Within an hour, Dr. Pierce's phone was pressed against his ear at Savannah Country Club, interrupting the board president mid-swing on the third hole. The words came smooth and practiced, "We have a credentialing issue." Nurse Walsh performed a procedure outside her scope. "I'm recommending immediate suspension pending investigation." The board president, still holding his driver, asked only one question, "How serious?" Pierce's voice dropped to concern-coded steel, "Dangerous precedent." "I've already contacted the state licensing board." The lie landed perfectly. The board president said 3 words, "I'll make calls." By 2:19 p.m., a state licensing investigator Margaret had never heard of was sitting in Pierce's office, reading through charts he'd carefully selected, the one showing her most confident assessments, her quickest decisions, her occasional deviation from protocol. Pierce narrated the story with the precision of a surgeon, independent decision-making, dismissal of physician oversight, a pattern of unauthorized clinical judgments. The investigator took notes. The investigator believed him. Competence looks like truth when delivered with enough certainty and enough cherry-picked evidence. The board had already voted by 4:15 p.m. Unanimous. Margaret's badge was confiscated at 4:23 p.m. by the nursing supervisor, a woman named Charlotte who wouldn't meet her eyes. "It's temporary." During the investigation, Charlotte whispered, as though that made it gentler. Margaret nodded once and walked to the supply closet, not the one where she fell apart, but the medication refrigerator in the back room where she could stand alone for exactly 90 seconds. She pressed her forehead against the cold metal door. The faded ranger patch inside her jacket lining suddenly weighed 300 pounds. The Pentagon's sole surviving neurotoxin subject was on Ward 4, still recovering from seizure protocol, and she had lost her clearance to approach him. She had lost her eyes on him. 3 soldiers had died in Helmand Province because of what they'd been exposed to, and Margaret had been positioned as the quiet observer, the medical intelligence asset sitting in plain sight, watching for markers only she would recognize. Now she was a suspended nurse with a security escort and a credibility destroyed by a man who hadn't needed to do anything but tell the truth selectively. The security escort came at shift change, 6:44 p.m., when the parking lot filled with incoming staff arriving for nights. 3 guards in company polo shirts flanked her through the emergency department doors, not roughly, but visibly. Colleagues turned their heads. The ER director was watching from the medication station. Two residents Margaret had trained stopped mid-conversation. One of them, a young man named Patterson who she'd taught how to secure difficult airways, looked at his shoes. The message was coded into the visual: she had done something serious enough to require removal. Dangerous enough to warrant security. Pierce had orchestrated it with the precision of someone who understood that humiliation was most effective when delivered publicly, when it contaminated the space she occupied, when it made other people uncomfortable to associate with her. She didn't speak. She didn't accelerate her pace. She moved through the ER like a woman walking toward her next assignment, her jaw tight enough to cut glass, her hand steady at her sides. The guards opened the double doors, the ones that whooshed with a pneumatic hiss, and she stepped into the parking lot where the evening sky was the color of old bruises. Rain had started, thin and cold, and it fell on her scrubs without mercy. The walk to her car was exactly 230 meters. She counted them. Counted the footsteps. Counted the raindrops hitting her shoulders like accusations. She didn't look back. Margaret returned to St. Michael's at 11:43 p.m., using her old badge code at the employee entrance, the one that hadn't been deactivated yet, the security clearance still flickering green in the electronic lock. The locker room was empty, fluorescent lights humming their mechanical prayer over rows of metal lockers painted an industrial gray. Her footsteps echoed on the tile. She opened her locker and removed her scrubs, the fabric still carrying the smell of antiseptic and something else, something copper and thin, the faint residue of the ranger's blood from her needle decompression, from her emergency cricothyrotomy performed with a scalpel taken from a crash cart. She folded them with military precision. Each crease exact. Shoulders aligned. Sleeves folded inward at 45-degree angles. The way she'd learned to fold uniforms 17 years ago at Fort Benning, before she became Captain Margaret Walsh, before she became the woman who could hold a bleeding soldier's lung in her hands and keep him alive while mortars walked across the compound. She placed the scrubs in the hospital laundry bin and sat on the wooden bench beside the lockers. The bench was worn smooth by countless nurses removing their shoes, removing their stethoscopes, removing the weight of 8-hour shifts. She stared at her empty locker. The magnetic nameplate still read, Walsh, M, Trauma RN. Someone would remove it tomorrow. The Ranger patch was still sewn inside her jacket lining, the stitches tight and precise, the faded thread barely visible. She could feel it against her ribs, a weight separate from her body, a tether to something she could no longer afford to be. 3 soldiers had died in Helmand Province from exposure to a novel neurotoxin that the Pentagon still didn't understand. The Ranger was the only survivor, the only living data point, the only subject the CDC and JSOC could study. And she had been positioned as his guardian, his silent observer, the trauma nurse who would catch any marker of the disease's progression, any hint of what the exposure had really done to his neural tissue, his immune system, his long-term prognosis. She had failed him by saving him. She had exposed the operation by performing medicine that was too good, too precise, too obviously not standard protocol for a county hospital nurse. She had destroyed her cover with the skill that was supposed to keep it intact. The fluorescent lights buzzed above her. Somewhere in the hospital, the Ranger was sleeping off the seizure medication, recovering from status epilepticus, and she could no longer approach his bed. Meanwhile, Dr. Pierce was in his office on the 3rd floor, compiling his report for the hospital board. His hands moved across the keyboard with the confidence of a man who had already won. He attached Margaret's performance evaluations, the ones praising her competence, which he would reframe as evidence of overreach. He included the chart notations from the cricothyrotomy, highlighting her decision to act without waiting for physician oversight. He wrote the paragraph that would matter most: immediate revocation of privileges is recommended to protect patient safety and maintain the standard of care. The words were formal and professional and would destroy her nursing license in 3 states. He hit send at 10:34 p.m., then opened his personal email. A message was waiting from the state investigator, marked urgent. Pierce's hand paused over the mouse. He opened it. Dr. Pierce, I've been reviewing the patient mortality data you submitted during the investigation of Nurse Walsh. I'm seeing some discrepancies I need to clarify. Specifically, I'm examining 15 deaths over the past 18 months where your documentation is incomplete and the pharmacy's fentanyl dispensing logs don't align with the quantities you recorded in patient charts. Can we schedule a time to discuss these findings? His blood pressure climbed like a bell curve. The words were casual, professional, the tone of a bureaucrat requesting clarification. But he understood what was happening. He understood the precision of the language. Incomplete documentation. Discrepancies. Quantities that didn't align. He had been so focused on destroying Margaret that he hadn't noticed the investigation's scope expanding. He had used his connections to accelerate the licensing board's review, but those same connections had triggered the state licensing investigator, the one he'd helped appoint 5 years ago, to actually do her job. To actually audit his prescribing patterns. To actually compare what he'd written in charts to what the pharmacy had dispensed. His fentanyl use wasn't clinical. It was personal. It was an itch he'd been scratching for 3 years, beginning after his divorce, growing worse after his daughter stopped taking his calls. Small amounts, easy to hide in the noise of a trauma department where opioids flowed like blood. A few milligrams here, a dose there, medication signed out to patients who'd received different drugs, or had received the fentanyl but not the doses he'd recorded. He'd been careful. He'd been so careful. But Margaret's suspension had triggered the full audit, and the full audit had found what Margaret's presence in the department had obscured, Pierce himself. He read the email again. The investigator had written 15 deaths. 15. The number sat on his screen like an accusation. He picked up his phone to call the board president. His hand was shaking. He told himself it was just procedure. Just clarification. Just a misunderstanding that could be explained by the chaos of trauma medicine, by the difficulty of paperwork in a busy department, by the simple fact that records weren't always updated in real time. The board president listened for 40 seconds. Then he said, "Pierce, I can't help with this. This is state level. You need a lawyer." The line went dead. 3 days passed. Margaret sat in her apartment in a house that suddenly felt too small and too empty. Her 17-year-old son, Marcus, watched her deteriorate the way children watch parents and understand that something fundamental has shifted. She stared at the television without seeing it. She made coffee and forgot to drink it. She folded laundry with the same military precision she'd folded her hospital scrubs, crease by crease, uniform by uniform, each motion the same. Marcus couldn't stand it. On the third night, he climbed into their attic using the wooden ladder Margaret had installed 5 years ago, the space above their bedroom insulated and dusty and protected from weather. Behind the rafters, he found what his mother had hidden, a locked footlocker with her name and rank stenciled on it in faded olive paint. Walsh, M. Captain, United States Army Ranger Regiment. His hands shook as he picked the lock using a butter knife. Inside, medals mounted on ribbons, each one folded inside military-grade plastic. Bronze Star with V device for Valor. Purple Heart. Silver Star. Commendation medals. Certificate of Service. A photograph of his mother in uniform at Bagram Airfield, standing beside a UH-60 Black Hawk helicopter, her arm around the shoulder of a female pilot, both of them smiling like women who had already survived the worst. He filled his backpack without asking permission. He drove to St. Michael's at 2:19 p.m. the next day, the medals weighted against his back like evidence of a crime his mother had been charged with, the crime of being too good at something that mattered. The hospital board meeting was scheduled for 3:53 p.m. in the administrative conference room on the second floor. Margaret's termination was the final item on the agenda. Marcus burst through the hospital lobby doors 17 minutes early, his backpack heavy with history, his teenage voice raw as he shouted toward the administrative wing, "Mom, they need to see these." The marble floor echoed. Security turned their heads. A nurse at the information desk picked up her phone. And in the hallway outside the conference room, where Dr. Pierce stood beside the board president reviewing the final paperwork for Margaret's termination, the universe shifted. The medal spilled across the polished marble floor like blood. the hospital lobby doors burst open at 2:02 p.m. on a Thursday, and 17-year-old Daniel Walsh moved through the threshold with the determined stride of someone carrying the weight of classified secrets. His backpack hung heavy from his shoulders that had grown broader in the 6 months since his mother had stopped coming home with stories. Behind the information desk, 3 administrators froze mid-conversation. Dr. Pierce stood next to the board president, both men reviewing the final paperwork for Margaret's termination, the universe shifting. "Mom," Daniel called out, his voice cutting through the atrium like a scalpel through silence. "They need to see these." He opened the backpack. The metal spilled across the polished marble floor like blood, ribbons catching the afternoon light that streamed through the skylights, metal catching and gleaming. A purple heart. A bronze star with a V device for Vela. A silver star. Margaret stood frozen near the elevators, her badge already gone from around her neck, and for the first time in 3 years someone saw her expression shift. Not fear. Not desperation. Recognition. Pierce's face went the color of hospital walls. The board president bent down to pick up a medal, his hands trembling, and read the citation embossed on its case. Captain Margaret Walsh. For conspicuous gallantry in Helmand Province, performed emergency thoracotomy under direct enemy fire, saving 3 critically wounded Rangers while coordinating air evacuation. He read it again. His voice cracked on the 3rd word. The lobby went dead silent. Even the fluorescent lights seemed to hold their breath. An elderly man in dress uniform stepped forward from where he'd been sitting in the waiting area, a uniform that nobody had noticed before because nobody was paying attention to retired generals. The hospital's Army Liaison General, 73 years old, 3 tours in Vietnam, 2 in Iraq, decorated in ceremonies that happened in rooms nobody in civilian life ever entered. He picked up the bronze star with the V device, then the purple heart, then looked directly at Margaret. He saluted. It wasn't a casual gesture, a hand raised in passing. It was the kind of salute that meant something, a full ceremonial salute, fist meeting chest, held for 3 full seconds while everyone in the lobby watched a decorated general honor a woman who pushed a crash cart. "Captain Walsh," he said, and his voice carried the weight of institutions and oaths older than any hospital policy manual. "Welcome home." Pierce made a sound that wasn't quite words. "Stolen Vela," he said. "She's lying. She stole. Her file," the general said quietly, "is classified top secret, SCI. Which means you just committed a federal crime by reading her personnel information without clearance." The board president set the silver star down on the marble like it might detonate. "What is happening right now?" Before anyone could answer, the hospital's front entrance swung open again, and a woman in a dark suit entered with the kind of presence that made the building's architecture seem suddenly smaller. Pentagon courier. Black briefcase. Eyes that had seen every kind of emergency in every kind of circumstance. She approached Margaret directly, placed the briefcase on a chair, and waited. Margaret opened it. Inside lay a single folder stamped with seals she hadn't seen in 3 years. Classified operation, medical intelligence asset, code name Valkyrie 6. A photograph of her in dress uniform, Captain Margaret Walsh, with her dates of service and her operational history spelled out in language that made the hospital's administrators look like children reading a menu they couldn't understand. CIA medical intelligence placement. Pentagon's only surviving subject exposed to novel neurotoxin variant B7. 3 soldiers deceased. 1 soldier in medical recovery. Margaret Walsh, sole operative with expertise and access. The ranger in bed 7, the courier said, is the subject of an active national security investigation. This hospital was never informed of his status. Medical records pertaining to his condition are now subject to federal seizure. She turned to Pierce. "Starting with your documentation of his treatment." The ranger himself moved then, moving the way men move when their bones finally remember what their brain forgot. He stepped forward, and his eyes found Margaret across the distance of polished marble and shattered authority. "Valkyrie 6, he said. His voice was rough, textured like gravel and recovery. "That's my angel." And the room heard it. The ranger remembered. He remembered the burning highway 6 months ago, remembered the woman with steady hands and combat-trained precision, remembered her voice commanding him to stay alive while she performed needle decompression with a ballpoint pen in the space between crisis and the ambulance arrival. A state investigator stepped out from beside the general, a man in his 50s with the kind of face that had seen many terrible things and learned to carry them without flinching. He approached Pierce with documents that had the weight of finality. Dr. Nathaniel Pierce, your medical practice has been under investigation for 18 months. Our examination of patient records reveals 15 deaths occurring during or shortly after treatments you supervised. Pharmacy logs show controlled substance diversions totaling 2,847 dosage units. Chart alteration spanning documented medical procedures. And the investigator held up a printout, 17 instances of forged medication authorization signatures that match the handwriting of Nurse Margaret Walsh. Pierce's hands began to shake. The tremor started in his fingers and moved upward toward his wrists, the same tremor Margaret had felt in her own hands in the supply closet, the shaking that came from adrenaline and fear and the understanding that everything was collapsing. You were setting her up, the investigator continued. If your diversion was discovered, you were planning to blame the nursing staff. Specifically, you were planning to blame her. The hospital administrator who'd signed the suspension order stepped backward, his career choices suddenly acquiring the sharp clarity of hindsight. The board president closed his eyes. The residents who'd smirked during grand rounds turned away, unable to meet anyone's gaze, knowing that they'd become accomplices to a systematic campaign of institutional cruelty. Your medical license is suspended effective immediately, the investigator said. The criminal investigation will be handled by the federal prosecutor's office. You have the right to remain silent. Anything you say can and will be used against you. 6 months later, Margaret watches from her new office window on the 3rd floor of St. Michael's Hospital in Savannah, where the late afternoon light turns the parking lot into a landscape of possibility. Her title on the office door reads Director of Trauma Services. Her credentials display Captain Margaret Walsh, RN, CIA Medical Intelligence Asset, Operational Status Active. On her desk sits the faded Ranger patch, no longer hidden inside her jacket lining but displayed openly, the artifact of a woman who can finally be seen. In the parking lot below, a white medical transport van pulls away from the loading dock. Dr. Pierce sits in the driver's seat, his hands still shaking as they grip the wheel, his medical license suspended pending criminal trial, his future restricted to supervised practice in rural clinics serving communities that deserve better than what he became. He drives supplies. He assists physicians who will never trust him. He watches younger doctors move through competence and authority while he remains permanently caged within his own failure. The Army Ranger, his name is Marcus, full name Marcus David Torres, from El Paso, Texas, walks the corridor outside her window with his physical therapist, his left leg still regaining the muscle memory of full weight-bearing capacity. He stops in front of her office door, and she can see him from above, touching his forearm where her name is tattooed. M. Walsh, my angel. His memory has returned in shattered pieces that finally reassembled themselves into a coherent narrative, the burning highway, her hands on his chest, her voice commanding him to stay alive. The way she breathed for him when his own lungs forgot how. He catches her looking and smiles. Margaret closes the window's blinds. She allows herself exactly 45 seconds of private satisfaction, not triumph, not vindication, but the deep exhale of someone who has been running for 3 years and finally stopped. She thinks about the supply closet. She thinks about the faded patch. She thinks about the 15 families who learned their loved ones didn't die of disease or circumstance but of negligence while their physician was impaired by the very substances he'd sworn to heal. Then she stands, smooths her scrubs, and returns to the work. The nursing supervisor sits in the conference room with 3 new trauma residents, all of them young, all of them watching Margaret with the kind of attention people reserve for legends they didn't know existed. Captain Walsh trained at Fort Sam Houston, the supervisor is saying. 12 years Army Ranger Medical Corps. 3 tours in Helmand Province. She performed emergency thoracotomies in combat zones where the only surgical suite was a burning street under mortar fire. One of the residents, a young woman with her hair pulled back and her hands already showing the calluses that come from excessive hand washing and patient contact, raises her hand. How do you do that? How do you operate under that kind of pressure? Margaret leans against the doorframe, and her voice drops half an octave. You remember that pain is information. Fear is information. The patient's survival is the only metric that matters. Everything else is noise. The resident nods, and something shifts in her expression, the moment when a person understands they're not just learning medicine, they're learning to be a warrior in scrubs. The ranger's therapist helps him up the stairs to the second-floor observation deck, where he can watch the trauma bay operations through reinforced glass. Margaret is down there, commanding the space with the kind of authority that comes from having held people's lives in her hands while the world burned around her. She's teaching a young nurse how to assess a trauma patient, where to look, what to feel, how to recognize the difference between panic and precision. The young nurse is learning from someone who taught rangers how to survive in Helm and Province, how to survive in St. Michael's Hospital in Savannah, Georgia. The transmission of knowledge. The passing forward of discipline. The survival of excellence through teaching those who come after. By evening, Margaret sits in her office reviewing patient charts, her computer screen glowing in the darkening office as the last light drains from the western sky. Outside her window, the parking lot empties. The day shift leaves. The night shift arrives. The hospital becomes a different entity after dark, quieter, more focused, the emergency medicine equivalent of combat operations in darkness where only the trained and the prepared can function. She thinks about the supply closet, and for the first time since she's returned to that position, she doesn't feel anything except gratitude that she doesn't need it anymore. She can be seen. She can be known. She can stand in the light and announce her name and her history and her qualifications without fear of institutional retaliation. The ones who have seen the worst often give the most. She closes her charts. She saves her files. She powers down her computer and leaves her office for the night shift nurses to manage the emergency bay, women and men who are learning that competence matters more than title, that expertise should never be questioned by ignorance wrapped in authority, that the quiet ones in the corner are sometimes the ones holding everything together. As you watch this story, I need you to understand something. Institutional cruelty toward competent women in medicine isn't just a problem for hospitals. It's a systemic disease that kills patients, that silences expertise, that elevates arrogance over ability. If you've seen this happen in your workplace, not just medical, but any profession where knowledge is dismissed because of gender or age or the sin of quiet competence, you need to speak. You need to document. You need to ensure that the next Margaret Walsh doesn't spend 3 years in a supply closet touching a faded patch and remembering who she used to be. Subscribe. Like. Comment. Tell me, have you worked somewhere that punished expertise? Because if you have, you're not alone. And maybe, just maybe, it's time to stop being quiet.